This presentation is for informational purposes only, and the information presented in this video is not a substitute for medical advice or a diagnosis. The Queen's College Step Test is a test used to measure cardiorespiratory endurance. It is a submaximal test that has a reliability of 0.92 and a validity of negative 0.75.
Equipment you will need includes a stopwatch, a metronome, and a 16.3-inch or 41.3 centimeter step. Use your best clinical judgment and screening tools to clear the participant for exercise, or refer for medical clearance if necessary. Be sure to screen your participant for possible health risks using a resource such as the Physical Activity Readiness Questionnaire. Some contraindications include unstable angina, acute MI or stroke, resting systolic blood pressure greater than 200 millimeters of mercury, resting diastolic pressure greater than 110 millimeters of mercury, decompensated heart failure, unstable arrhythmias, pulmonary embolism, and DVT.
Instruct the participant to step up using a 4-step cadence. Up, up, down, down. For males, set the rate at 24 steps per minute. For females, set the rate at 22 steps per minute. This test is performed continuously for 3 minutes. It is always important to monitor the patient during exercise testing.
One disadvantage to this test is that it does not take height into account, making it easier for taller participants. Some advantages of this test include little time required, minimal space, can be self-administered, and requires little equipment and cost. Compared to the Harvard step test, this test has lower step height, slower cadence, and shorter duration.
After the completion of the test, the participant stops and their heart rate is recorded. Locate the patient's pulse and record the beats for 15 seconds. Then multiply that number by 4 to get beats per minute. Alternatively, you can use an electric heart rate monitor such as a pulse oximeter. In order to keep the measures accurate, wait 20 seconds after the participant completes the test to record the heart rate. To calculate estimated VO2 max, insert the test results into one of these two equations. Use this table of the ACSM's Guide to Exercise Testing and Prescription to determine the participant's cardiorespiratory fitness classification by age and sex.